Concept number 1. Psychodynamic therapy. Psychodynamic therapy is a form of therapy focused on revealing the unconscious of the client's mind. It is heavily influenced by Freudian talk therapy, and it often includes the person discussing their issues with the therapist and the therapist psychoanalyzing them to release their hidden, unconscious thoughts and feelings in order to reduce their problems. One example of Freudian type therapy is called dream interpretation. I keep having a dream that I'm getting on stage to perform, and I'm completely naked. Well, this dream could be a sign that you're feeling vulnerable. Are you nervous about something? I am. I have a big performance coming up, and it's the first time we're performing solo since the Flaming Flamingos girl group broke up. Your unconscious bring out the Roys in your dream. Another aspect of psychodynamic therapy is free association. This is when the client says anything that comes to mind, regardless of what it is. I'm in therapy. I'm in therapy. Why am I in therapy? I'm wearing a pink outfit. I wish I was wearing a purple dress. My purple dress is at the dry cleaners. Why don't I drive a hybrid car? I should drive a hybrid car. I should start riding my bike to work. Bicycle, unicycle, unitard, unicorn, unicorn, unicorn. Well, it sounds like you have a lot going on in your life. A common attribute of psychodynamic therapy is called transference. This is when the client transfers his or her feelings onto the therapist, almost like a form of roleplay. I'm so mad at my boyfriend. He thinks he can tell me how to dress. This quack is probably just as bad as he is. I can't stand him. Always telling me how and why I should act a certain way. Did you perhaps have a controlling father when you were growing up? Oh my god, I did. Well, your childhood issues with your father likely contribute to your anger towards being told what to do. Concept number 2. Humanistic therapy.
Humanistic therapy is focused on highlighting the idea that people have control over what they do. Humanistic therapists, like Carl Rogers and his person-centered therapy, act as life coaches and help people become self-actualized and reach their full potential. Humanistic therapists follow 4 guidelines, the first of which is empathy. I've been feeling so sad lately. I completely understand how you feel. We've all been there. The second guideline is authenticity. I feel like you're so understanding and genuine. The third guideline is being non-directive, which means that the therapist doesn't interpret what the client says, but just clarifies and mirrors it. I just feel like he never listens to me anymore. I don't know what to do about it. So you're saying you feel like he doesn't listen to you. The fourth guideline is unconditional positive regard, when the therapist understands and accepts what the client says, regardless of their own views. Yeah, I was mad, so I flipped the table. What about it? I understand where you're coming from and why you chose to respond the way you did. Concept number 3, behavioral therapy. A behavioral therapist assumes that both normal and abnormal behavior is learned. As such, they implement techniques to try and change people's behavior. This is largely known as action therapy, where there is no need to reflect on the past, but instead focus on fixing behavioral issues. One example of behavioral therapy is systematic desensitization, where someone is gradually exposed to a stimulus that causes the person to become fearful. I'm so afraid of the color pink. Everywhere I go is pink, pink, pink. I can't stand it. I'm living in constant fear, and I just don't know what to do with myself anymore. Okay, let's have you look in a mirror. Now breathe. Imagine that what you are looking at is not pink, but it's purple. Oh my, purple. Oh yes, yes. I absolutely adore purple. Yes, keep looking, and I want you to gradually turn that purple into a red, and just keep breathing and stay calm. Oh, okay. Well, red isn't so bad. It's kind of close to pink, but not quite. Good. Now turn that red into a pink. Oh my god, I'm pink. Okay, I accept it. I'm pink. Another type of therapy a behavioral therapist can use to help treat a condition is called observational learning, with the use of a fearless peer. This is when the client observes someone who is similar to them in some manner, engage in the stimulus that causes them anxiety. Therapist. Rat. Along with the different thought processes of therapy, there are also different formats. For instance, therapy can be interpersonal, as we saw with all of the previous examples of the flamingo client with the duck, snake, and rat. However, therapy can be in different settings as well. For instance, there is also group therapy. This is common amongst people who share a certain problem. For example, this is highly beneficial for people recovering from drug addiction and alcoholism, for they are able to rely on one another as pillars of support.
Okay. People, can we just focus for a few
I
minutes?
don't want to talk about my mother.
Oh, not again.
Well, Phil, if it weren't for your mother, you wouldn't be here. Those are your words.
It's a stupid topic. I want to talk about what I want to talk about, not some dumb guy's dumb mother.
Whoa, listen, Miss Thorazine, you leave my mother out of this.
Hold it. We are here to talk about mothers, and we are going to talk about mothers.
Not
This
my
is
mother.
so
Come on,
stupid.
this
I
is
don't even
ridiculous.
need this.
In addition, there is also family therapy. A common form of family therapy is couples counseling. Even more so, families in which parents have recently gotten a divorce can attend family therapy, where members of the family can speak with the therapist both individually and in group format. Sometimes psychotherapeutic approaches aren't sufficient to help people with certain issues they're facing, such as depression. Biomedical approaches can be taken instead.